The mission of Family Health Centers of San Diego is to provide high-quality, cost-effective healthcare to the underserved populations of San Diego.
I think all the faculty and the students here are all really here for the same thing, treating an underrepresented population that does not typically get good health care.
San Diego had a very large immigrant and Latin community that back in the 1970s did not have access to health care. So in 1970, Laura Rodriguez, a community activist, staged a sit-in with other community members to try to make the city aware that the Latino population did not have access to health care. At that time with the sit-in, they forced the city to recognize that they needed to create a place for people to gain care. So at that time, the Chicano Free Clinic was created.
And out of that activism, Family Health Centers was born, and now we have over 40 clinic sites. Some of them are mobile medical units, taking care of a lot of people who are homeless, meeting people where they are, and there aren't that many places like that.
One of the things that drew me to Family Health Centers in particular within San Diego is we actually have a vastly diverse population just within our clinic system itself. I've had folks from all over the world as part of my regular continuity panel, and that diversity is something that is really amazing to be exposed to. We pride ourselves in being local, so global locally. It's not uncommon that I have days where I, have a translator phone for Vietnamese, for Haitian Creole, for Somali, and of course use a lot of Spanish as well. And just the ability to care for those patients from around the world and to get that vast array of experiences is something that led me to be here, and it's something I'm very grateful for.
We have patients from all over the world that immigrate here, and you just get to learn about the richness of their cultures and the barriers that they have in trying to maintain their health. And you become like a teacher to them in a way, and a friend in addition to being their medical provider.
I really wanted to be in a place where I could take care of people who actually needed it. I love that we have so many families from all over the world. The neighborhood where our clinic is a major resettlement part of the country, really. So you kind of get to do global medicine without leaving the country. I take care of a lot of people who immigrated here for a better life for their kids, are living here, and a lot of times can't get good health care elsewhere because maybe they don't have a great job that gives them health insurance, or they don't have their documents all in order and they can't really get health insurance, but they can come here.
So our program is a community-oriented, primarily service-based, urban underserved program. And if that lines up with your interests, then you're going to be in a very good spot here.
If you're interested in meeting people from all different types of nationalities, walks of life, this would be a great place to learn. So our residents come because we have interesting things like we have an HIV track. We treat hepatitis C, we treat hepatitis B. There's a lot of infectious disease because we're a border town. We have a lot of people coming from countries where they may actually have advanced pathology because they haven't had access to care. We have people coming from war-torn countries who have been living in refugee camps. So we have people who have a lot of need and they haven't had any access. So we try to give them as much care across all different modalities as we can. So we do everything, whether it's their medical care, it's their dental care, we have vision, we have physical therapy. And it's a lot easier for someone who's new to America who doesn't know how to navigate the system to come to one place where they can have it all done.
Pretty much anything that you can think of within a larger healthcare field will be provided within our organization as a whole. And we have an opportunity to access that for our patients and also rotate through those areas themselves during various parts of our medical training, from optometry to dentistry, physical therapy to developmental services to case management to older adult services. We have access to all those things, and you'll actually get a chance to kind of get a glimpse into what those folks do day in and day out during parts of your rotation, which really gives you a more holistic view of the medical field beyond an exam room, and to really learn how to optimize those things for patients who need those services and to better be able to explain things to those patients.
You're right in the community and you learn about all the medicine you would learn otherwise, but you also learn if my patient doesn't have money or great insurance, how can I still take care of their really severe diabetes or other health problems in a way that they can actually accomplish, because I can write a prescription for a fancy new drug that they will never be able to get. And so you kind of have to learn the workaround. You have to think about the trauma that people have survived.
There are a lot of programs out there where you will learn a lot of good medicine. So you will become a competent physician. But what I think is important, particularly for an applicant, is who are the patients that I will be treating? Because that's where you're going to really figure out what you're interested in, but also where your strengths are and how you can really connect to people. So we want people to come who are interested in meeting lots of different kinds of populations. And it can be a surprise. We always say that every day it can be a surprise. We say, you have to be ready. But that's what family medicine's about. It's about being able to roll with whatever comes in. It's being flexible, but it's really learning how to think on your feet. We are in the trenches, physicians, and so you have to be nimble and you have to be quick in your thinking and you have to be creative because a lot of it is maybe a little bit do it yourself or you have to work with limited resources, but we're good at that. As a federally qualified health center, we do that on a daily basis. And so we want residents who are ready to take on that challenge.
Here you'll receive a very excellent training with an extremely diverse patient panel, and we'll have support in carving out whatever interests you have within the medical field. And that fluidity is a definite strength of the program and one that can be leveraged into whatever you want to make of it.
I'd recommend family health centers as a residency program if you really care about social justice and you want to start doing that fresh out of medical school, that every day kind of coming to work, taking care of people who need it most, and at the end of the day, feeling like you made a difference.